Jeff, Allie, and I did our research project based on fibromyalgia and hydrotherapy studies and how the treatment of hydrotherapy affects those with fibromyalgia. When looking at hydrotherapy and balneotherapy, things to look at characteristic-wise would be the thermal aspect. Vasodilation, which is the blood flow facilitation, affects things like temperature. Vasoconstriction, which is pain reduction effects. Immersion, which is the pain reduction, which then improves the exercisability and then decreases the stress on the body altogether. Hydrostatic pressure is the blood flow promotion based on immersion depth, which then increases the blood flow to the major organs. The hydrotherapy types are normally classified by the temperature of the water, the mechanical stimulation used such as whirlpool or massage, and the materials mixed with the waters such as minerals or mud. Examples of the therapeutic purposes this treatment will provide are water therapy, aquatic therapy, pool therapy, balneotherapy, which is a hot spring and or spa. There are various health effects and advantages to hydrotherapy. One, that it's not physically irritating. There's excellent solvency, high heat capacity and conductivity, pure water density, which is similar to average water density in humans. The health effects that it has are generally a pure thermal mechanism and chemical, alone or mixed. The thermal mechanism mentioned prior in the slide before this, and the chemical being the various things used to improve skin integrity and immunity. In the slides to follow, we'll then discuss the two studies of balneotherapy and hydrotherapy, both used on individuals diagnosed with fibromyalgia syndrome, which is a musculoskeletal disorder characterized by chronic widespread pain, tenderness at marked sites of the body called tender points, and fatigue, often accompanied by a broad array of subjective symptoms such as sleep disturbances, headaches, irritable bowel syndrome, morning stiffness, paresthesia of the extremities, frequent psychological distress, and depressed mood. In our second study of hydrotherapy, fibromyalgia syndrome is a chronic non-articular rheumatological condition characterized by widespread musculoskeletal pain, increased pain at tender points, and is often accompanied by symptoms such as fatigue, non-restorative sleep, stiffness, depression, and anxiety.
The first of our two studies is our randomized clinical trial, and this one deals specifically with balneotherapy as a treatment for fibromyalgia. For our second study, we picked a systematic review, and this looks at the effectiveness of hydrotherapy in the treatment of fibromyalgia. It does include balneotherapy, but it uses other methods as well. This study was created to figure out if balneotherapy is an effective and helpful treatment for people that are suffering from fibromyalgia syndrome. It is a randomized controlled double-blind trial, and they did a 6-month follow-up. The trial had 100 people, and they broke them up into two groups, a balneotherapy group and a control group. The balneotherapy group used a specific type of water that's highly mineralized, and the control group used tap water. Both groups would do a 15-minute soak in 36-degree water. The control group's water was colored so that it matched the balneotherapy group, and they were observed by a physician that was also part of the double-blind to monitor them. After the 15-minute soak, they would follow that with 15 minutes of bed rest, and they did this 6 days a week for 2 weeks. They performed assessments 3 times, once at 2 weeks, once at 3 months, and then once at 6 months. And during these assessments, they would use questionnaires to determine primary and secondary outcomes. Fibromyalgia is hard to assess, so some of the primary measures they used were a change of global pain and a fibromyalgia impact questionnaire. And then the secondary outcomes were a widespread pain index, a severity scale, a health survey, an anxiety inventory, and then a depression scale. The water that they used for balneotherapy is high in minerals, and it's high in calcium, iron, and magnesium. So based on the answers to the questionnaires provided by both groups that went through, the authors were able to determine that balneotherapy could be a helpful treatment for people suffering from fibromyalgia syndrome. The outcomes came out to be fairly equal, and in that they helped to reduce pain and relieve stress and anxiety. They showed to have reduced mental health issues, provided relief regarding pain and muscle tension, and there was some improvement in the rehabilitation of injured muscles. So there were some drawbacks to this study. One was the sample size. It was a fairly small study of only 100 people, and they all came from the same location of Italy. And the other drawback was that this was only a temporary solution. The fibromyalgia symptoms came back after a certain amount of time, so they would need to do more research to figure out ways that they could possibly prolong the effects to make this more of a worthwhile treatment.
Hey guys, so I have the second study, which is for looking at hydrotherapy and fibromyalgia. The second study focused on like multiple modalities or interventions, where they were able to do a meta-analysis and a systemic review, looking at multiple randomized controlled trials to do that analysis. And they basically were searching for anything that had been in relation to hydrotherapy and its effectiveness, mostly because they were looking in particular for why there was such a limited evaluation of effectiveness for hydrotherapy on patients with fibromyalgia. So doing this, cross-sectional survey, looking at the different types of hydrotherapy, searching for balneotherapy, pool exercise, spa therapy treatments, physiotherapy, physical therapy, anything in relation to that. That's how they were able to minimize their criteria down into a particular target group. So overall, they wound up having to look at 1,900 different articles that were identified, and 10 of them were ID'd to be highly relevant and met that inclusion criteria. They only limited it to from 1990 to 2006 when they were posting the study in 2008. So they had a bit of time limitation there, but they also had looked into further discussing like background of supporting evidence or supporting effectiveness for pharmacological and non-pharmacological treatment interventions, like just basic exercise or your medications to go along with fibromyalgia, as they wanted to include those factors. And then they had discussed using a variety of methodology to complete this type of study, and their average methodological quality was like scaled at an average of 4.5 out of 9 on a Van Tulder scale, which is what they commonly use for qualitative studies, meaning looking at observations for yes, no, and don't know for that cross-sectional analysis to look at those different blinding components and demographic factors and variances. So other key points is that they had plenty of positive outcomes, specifically reporting in pain, overall health status, and tender point count. Those were the most common. There was exercise interventions that wind up being like mainstays and approached to be highly preferred in many of the studies, but most of them also had supported that hydrotherapy needed to be included because of how much improvement there is. And then the other effects of like particular specifics were like aerobic training on pain, fatigue, and sleep. They were just too weak and inconsistent, so it wasn't as valid, wasn't as strong of a study to use those points. They did one look where they had found 46 exercise-based studies, including 7 that were exclusively pool-based only, and they had found in just those particular studies that it showed strong evidence of supporting roles of exercise to go along with the management for hydrotherapy in fibromyalgia patients. They also conducted that cross-analysis, particularly with those co-interventions, spa therapy, pool therapy, balneotherapy, etc. And that's what those outcome measures wound up creating, that standardization between the 10 randomized control studies. So for the benefits in the second study, they were able to find many improvements. The only problem was that there was only an average of about 8 to 12 weeks of pain relief, tender point count relief, etc. for those symptoms and for alleviation. There was multiple subcategories to allow that comparison for those findings of that strong evidence with the hydrotherapy methods. So in particular, like that pain, health status, tender point count trigger areas that they really primarily focused on. Evidence also supported that hydrotherapy showed positive effects regardless of exercise, regardless of if exercise was added for additional co-intervention treatment, just to help support that. As like stated before, there was quite a few that had supported strong evidence for it, and then there was other support that it didn't really matter if there was or wasn't exercise, but they for sure either wanted them incongruent or in combination to each other, or one or the other preferred for the treatment. There's also studies found that completed in various countries that showed that physiotherapy's standard treatment methods for fibromyalgia patients included exercise and hydrotherapy being their most common approach, period. Northern Ireland in particular, like that's just their standard. It doesn't even, there's no questions. They don't even prefer to do medications treatments with that. Even though that's more common here, to add that to help relieve the symptoms for the patients. Studies also involved pool-based exercise therapy, only provided strong evidence for the role of exercise supported the overall role of exercise for management of symptoms. So again, that's that added information to provide that extra support. And then it also allowed for that qualitative review to look at the overall picture for subjective and objective data from all those different various factors and demographic factors that can be analyzed. So some of the drawbacks, it's because of fibro being such a progressive disorder, tends to be a progressive disorder, that there just needs to be more long-term research and to review and look into the true comparative analysis for the treatments overall with hydrotherapy. Many studies had failed to report details to allow internal validity of their methodology, so that had significant drawbacks. Generalized hydrotherapy comparison for parameters of established criteria had a bunch of types of limitations, particularly like how they only looked at English, studies published in English, so anything in other languages could have been relevant. They limited to published articles only with the tendency of the editors to publish studies with positive findings. So there could be publication bias, limited articles or published works prior to 1990, so that time parameter could be established in differences, and then anything co-interventions that were only included in the study, so like those parameters that had been set for that criteria. So anything that might be included outside of it might have been ignored. The review did not assess clinical appropriateness or cost effectiveness. Instead, it concentrated on statistical significance, which may not always reflect the clinical significance. So those are two different things, obviously, in the studies world versus evidence-based practice world compared to our clinical life in general. And there was also studies that had failure to conduct a long-term follow-up. So there was 2 randomized controlled trials identified as like highly relevant to the review, but excluded Okay, so for conclusion, the authors found that all forms of hydrotherapy reviewed were effective in the treatment of fibromyalgia. Improvements including that pain, the health status, anxiety, fatigue, function, and aerobic capacity. In general, hydrotherapy with or without exercise had a positive role to play in management of fibromyalgia. And then further research was continuously highlighted for additional randomized controlled trials where they specifically identified um, things like separate the cost of separate the effect of chemicals and heat in hydrotherapy, identifying therapy cost effectiveness, identifying additional benefits of exercise and water, determining if the effects of hydrotherapy are sustainable enough to be clinically beneficial, and so on.
There were quite a few similarities between the two studies, and then balneotherapy versus hydrotherapy. Um, they both of them were kind of inconclusive about the overall effectiveness of the two treatments, but they both did find that they had a significant impact on the ease of pain and tender joint count, and they both showed a reduction of the associated symptoms of fibromyalgia. Both forms of treatment can be known to relieve stress, which could in turn reduce muscle tension, and they both can rehabilitate injured muscles, as the water can help them to relax and relieve the pain. Each study was done in separate groups with different people, and each person was given a survey afterwards and during to fill out so they could track their outcomes. Both studies used randomized controlled trials, and there was inclusion and exclusion criteria for all the participants in both studies. And like I said earlier, they both talked about the need for further study to see if this would be effective treatment for fibromyalgia and other autoimmune disorders.
Okay, so for the differences between the two studies, particularly for the balneotherapy, it had usually been done in heated mineral springs. The water had been intentionally heated for better and more rapid outcomes. The study itself had completed a prospective meta-analysis. If you look through the information, you'd find that there was a flowchart created for that methodology and tables that did that comparative analysis for groups scores over like a certain amount of time that with those demographic factors of the groups to analyze it for the conclusion. They also had mentioned information including the safety parameters that were established for particular like adverse effects, which were just logged. If there was something seriously adverse effective, they reported it immediately and the patient had been excluded from treatment. For the hydrotherapy, it was usually done just in pool or water that can be mixed with minerals or mud. Most of the studies didn't complete using that, but the water in hydrotherapy is normally at neutralized temperature. They had felt that meta-analysis was not completed due to the heterogeneous nature of the interventions, so they considered it inappropriate. Therefore, they decided to complete more of a qualitative review for that data extraction had been actually completed by 3 independent reviewers. So when they looked at the qualitative information, they were able to really source into those external and variable factors. Conclusions for the effectiveness on each modality in hydrotherapy as a whole had been based on a rating system commonly used in systematic reviews. The outcomes for each study had results of primary outcome measures in particular, whereas the balneotherapy, I believe they had discussed possible secondary, so symptoms that had been outside the primary factors. But for this one, for that primary outcome measures, they particularly looked at the pain, function, and the quality of life. And then that also, in their study, they were able to create a standardized patient size or pool by using those credible databases from those human trials from 1990 to 2006 in English.